Hello, I'm Dick Corsell, and welcome to Community Care Network Connections. Community Care Network is the parent organization of Rutland Mental Health Services and Rutland Community Programs. And today, we're going to be talking about a program of Rutland Community Programs, and it is the InterAge Adult Day Program. And joining me today is Loryn Hamilton. Loryn is the director of the InterAge program, and Joan Parker is a nurse at InterAge. So we are going to talk, this is the first time that InterAge has been featured on Community Care Network Connections. We've covered a lot of topical areas since we've been doing this the last couple of years. So it's great to bring in Rutland Community Programs program, and in particular one that seems to be meeting a very important need in the community. So I want to start out with Loryn. Just kind of overall, we all know about programs for younger people, and but what is an adult day program? I think people would be very interested in what that actually is.
An adult day program is in the state of Vermont for adults 18 and older who have cognitive and or physical issues. And it's a place for those people to come to do socialization, to do recreation activities, and to give their caregivers, if they have caregivers, some respite so that their caregivers can do the best job that they can. It's a safe, comfortable, happy place for those people to go. Okay,
so now InterAge, let's talk a little bit about InterAge. Not a little bit, a lot. We have this, this entire program is devoted to this. How did the InterAge program get started? How long has it been around, and what need had been identified in the community that resulted in InterAge becoming an actual program?
My understanding is that sometime in the last 20 plus years, there were some community partners when adult days started cropping up around the state of Vermont that came to Rutland Mental Health. They had gotten together and identified the need for an adult day in Rutland County. And they went to Rutland Mental Health and asked if Rutland Mental Health would sponsor an adult day program. So they said yes, and it actually started out at the Stafford Technical Center. I think there were 3 participants and a director. And the name came because they interacted with the preschool program at the Technical Center. So it was kind of an easy way to say InterAge. And we do continue to, through today, we have school groups come in. We always welcome grandchildren and staff's children because the adults love to interact with the kids. So
my grandson and granddaughter have both come and volunteered their services, and they love it. And the participants love to have them come.
The participants adore them.
Yeah, they have a great time.
Well, now let me ask Joan, you're a nurse, been a nurse for a number of years. Many years.
Many years.
Now, why would somebody need the services of InterAge? I mean, what do people, Loryn, you said that this was a program for 18 and above, but what would be the need that would have a family seek the services of InterAge? Or what is it that you do that really would be more difficult to do or need to happen for?
Well, we're seeing now a lot more of the family members are keeping their parents home with them. And they sometimes have to, of course, continue with their weekly jobs. And in order for them to continue and feel that their individual is safe, sometimes they can't be left alone, so that they could come to our program where that they would be safe until their day's work was over, and then they could go home. Lots of times too, we have some socially isolated people that would sit in their recliner and watch TV and not move all day and take naps. If we can get those people to come in and join our program, it's stimulating, and it's good for them to get up and get moving.
Who uses the program? You talked about families that may have someone that requires oversight. I mean, are these people generally, do they live on their own? Are they living in an assisted living?
Do you want
For somebody that
Yeah.
needs to have help during the day, what do they do? Because this is not a residential program, right? This is a
Correct.
day program.
Right.
Where do they live? I mean, how does this?
Most of them either live with a family member, or some of them do live by themselves but have a constant caregiver there, either through the visiting nurses or
The home provider services.
Yeah, and those would be the kind of people that really should be coming to our program.
Oh, I'm going to ask Loryn now. InterAge recently expanded. You're at a
Yes.
new location. Actually, you're back at a
We're
location
at
that
a
you,
new, we're at an old
new.
location.
Old new location.
Old new location.
or a new old location.
Yes, yes.
Tell us a little bit about the expansion of InterAge and where you're located and one of the benefits of being where you are now located.
Well, in January of this year, a program called PACE Vermont, which was located in the Maples facility off of Stratton Road, announced that they were closing. They had 72 participants in their program who, because of the closing, were going to be left without day program services, which was one of the services that PACE provided. It was kind of a, I guess, for lack of a better way to say it, a no-brainer. We were here. We actually, when PACE Vermont came to Rutland almost 6 years ago, it was InterAge that started the day program for them. So we had already been with some of these participants for almost 3 years, providing day services. So we stepped in and offered to have those day services for their participants when they went out of town, when they left town. And consequently, we have, I think, 36 PACE participants who have come over to InterAge, and we provide day services to them. And we do that at the Maples. We were up on North Main Street. Unfortunately, we didn't have enough space to accommodate all of the PACE participants in addition to the participants that we had already. So initially, we opened up at the PACE site at the Maples and had about 17 people. PACE site is much, much larger than our North Main Street site. And we finally just decided that it would be a better thing all the way around for the participants first and foremost, for the staff, for everybody, to consolidate the two programs together at the Maples, because it is a bigger site. It had a few more amenities than we had at North Main Street. And we moved on June 3rd. Pretty flawless, easy move, and everybody, I think, has really been enjoying themselves. The staff gets to work together. They don't have to go back and forth from one site to another. The participants were all very excited to see some people that they hadn't seen, because we had some PACE participants at North Main Street, but not all. So now everybody's together, and we just have a wonderful time.
It's great.
We really
It's
do
great
have a
fun.
wonderful time. We're serving approximately 35 people a day right now. We have 50 participants total that we serve, but we don't have 50 at the center. We could. We're certified to serve up to 55, but at the moment we do about 35 a day.
On an average.
So the population is aging, certainly in Rutland County. We know that. And aging in place is a concept that is, I think, really is meant to help people continue to live as independently as they possibly can.
Absolutely.
So, Joan, could you take us through what a typical day at InterAge, like from when you open, what would someone, if somebody is watching this program and saying, boy, I have a family member who really should have some level of interaction during the day that may be eligible. What would a typical day look like for somebody that participated in InterAge?
Well, we open our doors at 8 o'clock for participants to start coming in, because they come in at various times of the morning as a rule. And we have coffee and tea going, and the newspaper's there. We kind of get warmed up. We chat amongst ourselves and, with the participants coming in and whatnot. That goes on till about 9:30. And then we do what we call brain teasers. We want to get them going, get their mind working so that it helps to make their day a little bit better. But we do crossword puzzles. We do hangman. We do big words, pick as many little words as you can out of it, anything to get your mind stimulated. And that will go on till about 10:30, 11 o'clock. And then we do activities, which includes anything from entertainers coming. We have the therapy dogs that come quite frequently, and the participants love that. And we play dominoes. We have bingo.
Arts and crafts.
Arts and crafts. Yeah.
Guest speakers.
We're quite busy for that period of time. And then we do at 12 o'clock. We do what we have chair-based exercises, and everybody participates in the exercises. And we do have bone builders for those that are.
4 of the staff are trained bone builders, facilitators through RSVP,
which is another Rutland community
Rutland community
Right.
program. So that's a nice collaboration that we have with them.
Yeah, that works good. So we do that for a half an hour, and then we have 12:30 to 1:30 is our lunch, and we all sit with the staff sits with the participants, which is, I think, wonderful at lunchtime because they can tell the best stories ever, and I enjoy that part. And then at 1:30 we have a quiet time. We've kept them pretty busy all morning long, so we
staff and participants.
So we kind of take a little break. We have a few recliners. People can put their feet up and rest for about an hour, and some just want to do a jigsaw puzzle or a word search, play little cards, as long as it's quiet. And that goes on till about 2:30. And at 2:30 we have what we call a I'm trying to think of what it's called.
Up and
Atom. And we get the people going for an hour there. We have we bowl. Sometimes we have tournaments.
We fish.
We play
race
baseball.
Cows.
Yes, we race cows.
That's a favorite on the Wii.
We play little horseshoes and bocce ball we play. And
we have target practice.
Yeah.
Snowball throwing.
Yeah.
We really get them going.
Yeah, and it's fun.
In that half hour. And they love it.
Yeah, we laugh.
They just love it, and the staff gets involved in it.
Because when the staff gets into the tournaments, then the participants are rooting for their staff, the person, we kind of split it up a little bit, and they think that's pretty fun. So that works good. And then about 3:30 we have
Mind
motion, which is like trivia questions. It's not too strenuous, but it kind of gets them a little bit, their mind going a little bit in that time too. And then about that time of the day, they start to dwindle out a little bit. They start to go home, and
it's sort of a free period from about 3:30 to 5.
We do a lot of reminiscing. They love that when you sit and just chat with them. They pick a subject and they'll just go on about it, what they did when they were little and what, which is fun. So it's a pretty busy full day, but we have a lot of fun.
It sounds like a very
laugh a lot.
busy day.
We do laugh a lot.
That's important. Very important.
Yeah.
Well, let's talk, Loryn, about the staff at InterAge. Now, you said you can serve up to 50 individuals.
We're certified.
But you're about
to serve
35 right now.
Yep.
What is the staff? How many staff do you have? And what are some of the qualifications? Obviously, we know Joan is a nurse, but what are some of the qualifications the staff have? And how do you select your people?
How do I select my people? I have 8 staff people right now. I have 2 nurses because we are what's called a medical model adult day, and Joan can elaborate on that maybe after I talk about this. The state requires that we have a staffing ratio of 1 staff person to 7 participants. I carry a 1 staff person to 5 participants, primarily for the safety of the participants and the staff, because the acuity levels of a lot of the people that we serve are quite high. And oftentimes a participant may need 1 or 2 staff people to assist them with an activity of daily living, which takes those staff people off the floor and that sort of thing. And our biggest concern is the safety of the people that we serve and the safety of the staff, because if something happens to either one, it's not a good thing. So I maintain the 1 to 5. Our direct care staff are high school graduates. All of them have experience working with the elderly. Even though we serve 18 and older, our average age is 81. We just had a birthday for one of our participants yesterday. She turned 94.
Great.
She was chatting about how she was 94 and telling us all about her life, and so that's really fun when we get to share that with people. And we've had people as young as 22, so it's quite a stretch. But I look for people who are compassionate. Compassion, you know, when I'm sitting and interviewing somebody for a direct care position, you can just see, you can tell by looking in their eyes and by the way they talk that they have compassion, that there's something about working with the elderly, and you just know when people love it. And people do love it. They really, really do love it. It's a wonderful, wonderful genre of people to work with.
Well, let me follow up. Joan, Loryn had mentioned the medical model, that InterAge has a medical model. What is the medical model? How does that differentiate InterAge perhaps from an adult day program that does not but does not incorporate that concept?
Well, the medical model means that we observe, of course, our participants. We have a lot of, we can do ostomy care, and we can do, we take care of a lot of diabetes. As far as diabetics are concerned, as far as giving them insulin and checking their blood sugars. We do oxygen therapy. We actually have a few people with oxygen there now. And we do nebulizer treatments. We have foot care. We also, am I missing anything?
Medication administration.
Medication administration, and we can
Pillbox fills.
pour pill boxes if the participant's family requests that for them. We can do that. Let's see, and we have what we call a wellness workshop, which we get people come and give little in-services in regards to, we had nutrition, somebody come and talk, and that includes the participants as well as their caregivers.
And the community.
Yes.
We invite the community to those there once a month.
And they talk about, we had someone in there for skin care, for eye care, for dehydration. We have quite a little variety of
Ears,
people.
hearing.
Yeah, we get anything we think that might help the participants. We also have a support group, a caregiver support group, which we do once a month, that the caregivers can come in as well as the general public. If it's a great group.
It is. It's
a
a
lot,
wonderful.
yeah.
It's a wonderful
We've seen-
networking group.
Yes, we've seen great progress with some of those people that we've had in our caregiver group. We also collaborate with the doctors and the participants' families. That's a big thing at InterAge. All the staff is constantly watching the participants, and if you can see something different, sometimes people have a urinary tract infection, they get a little more confused, and our staff usually can pick up on that. They'll come tell either me or my other nurse, Tammy, and we'll call the participant's family member and suggest maybe, they should see a doctor, and the family member will take it from there. So it's a good collaboration there.
Well, speaking of collaboration, I mean, one of the things with Rutland mental health programs and Rutland community programs, there is a lot of collaboration that goes on. I mean, it often no one program can meet the needs of all of the participants, and it requires collaboration with other community providers. So, Loryn, I want to ask you, who are some of the other providers that you work with closely with InterAge that are important to help you do?
Our community partners, yeah, very important. Well, in addition to RSVP, we also work with the one-to-one volunteer driver program through Community Care Network, through Rutland Community Programs. They're wonderful for people who, we say, fall through the cracks in the transportation department because we don't have our own transportation. We rely on the bus. We rely on volunteer driver services, the area taxis, and the families. One-to-one's been wonderful. We work really closely with the Southwestern Vermont Council on Aging. A lot of our referrals come through them, through their case managers. We're working with the case managers there all the time, as well as Rutland Area Visiting Nurse and Hospice. They have case management as well. We get a lot of our referrals from them. Who am I missing? The VA we work with. We have funding. We have a few VA participants who are funded through the VA, which some people don't know about. So we work with the VA. We actually, not me, we are going to be starting a collaboration with CAP, Community Access Program. They'd like to come in and see how we work with our seniors, our elderly, what kinds of things we do. So they're going to be coming in and talking about programming with us and what can they do to add to their programming for their population of people. So that's going to be a nice, it's really nice to work within Rutland Mental Health, within Rutland Community Programs, but it's also really important for us to establish really good community partnerships because we're all working together. We can't work alone. We all work together to keep people independent, to keep people at home as long as they can be, to provide the caregivers who are giving so much of their time, so much of their emotion, so much of their physical selves to caregive. They use all of us, and it works better when we all work together.
So let me ask you, either of you, how does somebody how do you become eligible for InterAge, and who pays for this? I mean, this obviously is a service that, with staffing and facilities, there's a lot that goes into a program like this. So, who's eligible to participate in InterAge, and then how does this get paid for?
Okay, you want me to take this?
Yes.
one?
Okay. This is your.
As I stated earlier, the state mandates that we serve adults 18 and older, but our average age right now is about 81 or 82. And to be eligible for the program, you have to have either a cognitive or physical issue, or both. Ordinarily, senior citizens, anybody, I have to be careful of the age, over the age of 70 has some sort of medical issues, physical issues, a lot of mobility issues, that sort of thing. Alzheimer's, other dementias, there's some confusion. A lot of people think the only dementia is Alzheimer's. There are several types of dementias that we deal with. We have stroke participants. We have participants who have suffered strokes, cerebral palsy. At any given time, you could walk into our building and there could be 15, 16 different issues that people are dealing with. There has to be, if they're socially isolated, they're eligible. If they're an elderly person who's socially isolated, they're almost automatically eligible. For people who live with family or with a care provider, there has to be some proof that that care provider needs some respite, whether it's to stay in a job or just because they're physically and emotionally exhausted and they need some time to refuel and be the best caregiver that they can be. As far as funding is concerned, there's several funding sources. Our primary funding source is Medicaid, but we also have funding, as I mentioned before, through the Veterans Administration, through the Parkinson's Disease Association. There is a small grant that we have through them. So if somebody has Parkinson's disease, we can get them monies for services through the Parkinson's Disease Association. We also have money through the Vermont Dementia Respite Grant Program, which is administered through the Council on Aging, who we work with very closely. Private pay. People who have private pay are eligible to apply for a reduced hourly rate. Oftentimes, it can be difficult for somebody to afford the hourly rate, so we always offer the ability to apply for a reduced rate. Am I missing?
No, I think you got them all.
I think we got them. Oh, private long-term care insurance.
Oh, yeah.
Most, I've never run into any that hasn't, most private long-term care insurances cover adult day services. So there are several funding options out there.
Yeah, I mean, I would think that services like this are far more cost-effective than the alternatives.
Institutional care.
That's the whole point of,
And
right.
it was, when you talk about, Loryn, you talk about the Community Access Program, or Rutland Mental Health Services, CAP has appeared on this program and various programs numerous times. And one of the overriding themes that we talk about with programs like CAP and obviously InterAge is they're community-based. And community-based programs, in addition to actually being better for the majority of people who need them, but they're far more cost-effective
Right.
than any of the older models that used. And with CAP, we talked a lot about when Brandon Training School closed back in the early 1990s and how the community-based model came about. But I would imagine that with a desire to have somebody that needs these services as they get older to be able to have them on a day basis without the need for institutional care, which just probably is not in their best interest unless, of course, their needs are that significant.
Sure.
So if somebody is interested, somebody watching this program, for example, and says, I really want to learn more about this InterAge program, it sounds really interesting, can they stop by, get a tour? I mean, what's the best way to find out more about whether or not perhaps this is something that would be good for somebody that I know?
We welcome people at any time. We're open Monday through Friday, 8 to 5. Our doors are wide open. Come in, all of the staff can help. I'm there every day. The nurses can answer questions. We can give you a tour. If you're currently working with case management through Rutland Area Visiting Nurse and Hospice or the Council on Aging, you can talk to your case manager about a referral to our program. It's pretty easy, and once you make the initial contact with us, whether you do it yourself or you come through an agency, one of the community partners, we will set up what's called an assessment visit. It's a 3-hour visit with us without your caregiver, if there's a caregiver involved. And you come and you spend a morning with us, and we get you right into the group, and you participate in the morning activity, and you participate in exercise, and you get to have lunch with us, which is always fun. Everybody loves lunch. It's like elementary school. When you ask them what the best part of the day is, it's lunch. And that gives us a really good idea of what the person's needs are. Some of the adult days in the state go to the homes and assess. We've always found it to be better for us to assess somebody in our building because that's where we're going to be providing the services. And we oftentimes see a very different person than what we're initially told about when their caregiver or a case manager contacts us.
Sometimes when the family comes and asks us if we could do this, they will tell us that so-and-so does this at home. I hope he doesn't do it when they come in. But 9 times out of 10,
we see a very different person than the person that the person
they see
is at home.
Of course, it's the family, so sometimes the the individual gets a little ornery with the family, more so than they do with us.
Yeah, well, I would think that that whole respite component, I mean, even if somebody is in a significant amount of care, but just for the ability to get some relief, and for the person going to InterAge, I mean, that can be stressful living in, if you are living in somebody else's house, and it's not as easy as it is, if you're in your own home. So I would imagine that this provides, the people that you serve at InterAge some respite as well. This isn't just respite.
Sure, everybody needs to get away from everybody.
Absolutely.
In any kind of a relationship, a marriage, children and parents, whatever, you need time away from each other. And our participants really do enjoy having their time. A number of them call it the club. Some of them call it school. Some of them think that they're at work. Whatever works. And that's what they enjoy, and that's what they look forward to. And it's really, really, it's such a good feeling when people say, if they've been out sick or we've been closed for a holiday or something like that, when they come in and they say, I'm so glad to be back. I missed everybody so much. We actually have one lady that's been with us for a number of years, and she dreads the weekends. She comes every day, and if you ask her on a Friday afternoon, are you ready for the weekend? She'll say, I don't like the weekend because I can't be here.
Yeah.
And that's really gratifying. That
rewarding.
Really justifies what we do every day.
I had a lady that was leaving the other day. She came for an assessment, and on her way out, she gave me a big old hug, and she goes, I hope I can come back. She says, I had so much fun. And she gave me a big old hug and a kiss. It was just the cutest thing. I said,
And
you
you've
can
never
come
met
back.
her before
Never.
until that day?
No. She was just so happy to be with us. It's very rewarding.
Well, that's great. So you're located in the Maples complex, which is off of Stratton Road, I believe that
Right,
General
on
Wing.
General Wing Road. We're in the
General Wing Road.
first Maples building. There are 2 Maples buildings. We're in the first Maples building on the back side. So you have to go to the end of General Wing
Okay.
Road, go into the parking lot, and you'll see the signs. for
And
InterAge.
for those people who want to contact you by phone, what's the best number to use?
802-773-2011.
Okay, and website address? Do you have one?
We don't have a website, but we are on Facebook. So
Okay.
it's facebook.com/InterAge Adult Day Program, all one word.
Great.
So.
Great. Well, Loryn Hamilton and Joan Parker from InterAge Adult Day Program, thank you so much. This is a great topic. I think for a lot of people, this is maybe the first time that they've heard about this resource. I know you get the word out, but it's always good for people to know that there is help in the community. And as we talked before, I mean, it's an aging population, and the need for these type of services is going to only grow. So I want to thank you both for being here.
Thank you for
Thank you
having
so
us.
much.
Great program. I'm Dick Corsell, and you have been watching Community Care Network Connections.